Hello and welcome to the second session of today's McKnight's Workforce Development Forum. You've tuned into Does Your Staffing Agency Care About Quality Assurance? I'm McKnight's Senior Editor Kim Marcellus, and I'll be moderating this event. We're going to have a great discussion on getting the quality you expect and deserve from what is likely your most important service provider and partner right now, your nurse placement partner. I'll introduce our two speakers in just a moment, but first we do have some housekeeping to take care of. If you have any audio problems during today's presentation, please first check the volume control on your device. This is the most common cause of audio problems. You can also use the help button if your own troubleshooting doesn't work. We will have time for a Q&A near the end of today's presentation. If you have any questions, please feel free to submit them starting right now in the box on the left side of your screen. And while we don't have any slides today, as we'll be using a discussion format, our sponsor has provided some related resources that you can view or download. You can also find those on the left side of your screen under the Handouts tab. Now, regarding continuing education. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards. It has been approved for 1 clock hour. However, you need to stay tuned into the entire event during the original broadcast to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed to the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can then view or save your certificate. A copy also will be emailed to you after today's live event. And now let's meet today's speakers. I will be moderating a great conversation with Lynn Berry. Lynn Berry is Senior Director of Clinical Operations at IntelliCare, and Lynn heads clinical quality and compliance efforts there. She's an innovative, results-oriented nursing leader committed to improving health outcomes and health equity. Prior to joining IntelliCare, Lynn was a clinical nurse manager and a nurse administrator at Atrius Health. We also have Greg Hunjan today. He's Executive Director at Stone Rehabilitation and Senior Living in Massachusetts. Greg began his long-term career as a certified nursing assistant and has held various administrative roles over the last 10 years. At Stone, he's been tasked with building a strong interdisciplinary team to improve quality and care outcomes, even amid a national labor shortage. So both of these speakers are well-versed in the things we're going to ask them to talk about today. So let's get right into it. Welcome, Lynn and Greg.
Thank you.
Thank you.
So let's kind of start at the beginning of why we're all here today, and I'll do a little bit of scene setting. While many nursing homes we know have been able to reduce their dependency on agency in the last several months, many are still using them in a more limited manner. In fact, agencies and their nurses are crucial partners, even when there aren't major labor shortages. Kind of a partner you always want to have in the game, even amid some of the criticisms and concerns in the last 3 years. It's also not a huge surprise that many providers have told McKnight's they may have to once again increase agency this year, especially if CMS moves forward with a minimum staffing standard. So at the same time, we've seen studies that indicate broad use of temporary staff can impact quality because of concerns around consistency. There's also been an increase in legal ramifications for some providers whose agency partners didn't adequately screen nurses or other staff that were placed in their buildings. So providers really have an obligation, I think, to work hard to identify staffing partners who can deliver high quality and well-vetted nursing staff who not only show up on time, but they show up consistently and help you improve your partner care your patient care in a real partnership. So, let's talk about how we can get some of those insights as to what the staffing agency actually does to ensure quality for you. I think some of the things we'll hit on today are nurse training, performance improvement targets, safety and HIPAA compliance, and operational and technical support of the partners. So Lynn and Greg, you're going to help us understand which questions to be asking and why each matters. Greg, you're on the ground and in the position of a lot of our webinar attendees today, so I'm going to make you go first. Always the lucky person to go first on these. Talk to me a little bit about why assuring quality of care is such a critical thing for long-term care operators.
Definitely. So, with quality of care, it's our underlying product that we provide as a skilled nursing facility or any sort of healthcare facility for that matter. With quality of care, it's obviously necessary to have the utmost top-notch quality that we can find. Is that comes down to what we provide, what we also who we have on board, and the interdisciplinary team and their capabilities that we have. So quality of care essentially can make and break us. And I know with the challenging times that we have had with the pandemic and all the eyes that are on healthcare, and in my particular case with long-term care, um, quality care has been even more so scrutinized and is actually more. I don't want to say even more important, but the attention's on there even further so than what it has been, and that's when you have a different accreditations with, obviously we look at DPH, but when you have the accreditations of Joint Commission, you're showing this kind of doing a standard above. And I think that's where, without having the proper quality of care, you can see the impacts in the bottom line as far as your referral basis, the revenue that you do make, the type of patients you do get. Um, so quality care really drives the overall healthcare business, and that's where without it, we wouldn't be able to operate and actually operate at a top star rating.
Greg, I want to ask you, I think good, just for folks to know a little bit more about you. Can you tell us your journey with agency staffing over the last few years? Particularly, were you using much at all before the pandemic, and kind of where are you now?
Yeah, agency usage has definitely climbed, and I can go back to when I started on the floors and I had fellow coworkers that were on staff and very little to minimal agency coming in and out. As the years went on, slightly before the pandemic, I would say 4 or 5 years ago, I think we did see a little bit of an increase with some of the shortages beginning, but with the pandemic, it really ramped everything up and it took new heights when it comes to the agency uh, usage within facilities. And with that, it's definitely challenging when you look at the financial end, but I think it also is a bit challenging when it comes to care at times when you try to look for, like, we highlight consistency. Um, so overall, it has, as far as numbers go and usage goes, about 30 to 40% of our weekly hours can be agency hours. When in the past you were talking maybe sometimes 10% of it. So it's a big
So
substantial jump in hours used as well as that cost associated with it.
that's pretty significant, even at this point in time. I know Massachusetts certainly has its fair of labor challenges, or its share. So again, want to get an understanding of you have two, I guess, classes of employees in the building, but they're all caring for the same patients. So let's talk a little bit about training. So with your full-time staff, for her, you are responsible. Your building is responsible for training. Kind of talk a little bit about how you train to provide quality care.
Well, in Massachusetts with DPH, they define staff as obviously the staff that we have on board, but any vendors and contracted employees or anybody coming into the building becomes our responsibility. So, with that in mind, we take that approach with how we train our full time staff. One, we look at having consistent agency staff that can come in and be the essentially work 40 hours as if they were our employee, but we treat them the same way where we any education we're rolling out, they're a part of it. Any sort of opportunities to make improvements, they're right there with us, and they were able to show them because we want to make sure their experience um, is just like one of our own staff members, and so that way they feel welcome. They want to come back to us, and in certain cases, sometimes they will decide to come on board and become a full time staff member. So it really comes down to treating them just like they were one of our own staff members, and that it goes beyond just with the front line. It goes into recognition and acknowledgement when it comes to morale boosting. Um, so different events that we've had here, we have them included. Whether we're doing that monthly breakfast, we make sure that they're more than welcome to join us, and it's just to encourage them to come back and little things like that can really help improve their experience, but it just translates over to the quality of care that we provide because they're coming to an environment they enjoy being.
So let me ask again, knowing that you have folks who are maybe not been in skilled nursing or not been in your building ever before, what are some challenges that you would face with an agency nurse coming in and things that you want to bring them up to speed on? How do you work with them to get them on equal footing?
And each facility has their way of doing things. Obviously, we overall provide care, but the means of how we provide care can vary depending on just documentation or the layout of the facility. So we do a kind of a crash course orientation with any new agency staff member coming in to help them familiarize themselves with some of the key policies and key areas that they'd be working in. And obviously, the challenges can be which platform for medical records or their skill sets when coming in. So, trying to put that agency staff member in the best kind of position to succeed. And obviously, that continues on, not just that crash course orientation. It continues on through that first shift with the coworkers that are around them to help navigate through, and goes into the next time they come in. So it's just building off of that and kind of partnering up. And we roll out here. We have a mentor program that is designed for new hires, but we've expanded on that where senior staff that have been on board, the new agency staff members require that mentorship as well. So it's not it's, in that essence, it's treated a certain way as if we have a new hire coming in, and how would you want them to feel welcomed, and how would you want to feel when you walk into a new place. So that really becomes a crucially key part to how we overall can have the agency staff member just be one of us and one of our team members.
Well, let me pick on you one more time before we move to Lynn. When it comes to readiness, both the clinical and operational readiness, do you find differences? I guess an important question to back up would even be, do you use various agencies or have you used various agencies throughout the process? And then the second part is, if you do, what differences do you see in terms of the readiness of the people you're bringing into your buildings?
There definitely is a difference, and it I've used a variety of different agencies. Right now, we can sometimes have up to 4 different agencies within the building at one moment, and the preparation kind of sometimes shows. And experience is one thing, but I obviously what the agency can do to help form a skill set, so that way we know that any staff member, any nurse or CNA coming from that particular agency is going to have certain criteria that's met, and it's going to be a certain standard of care that we know they'll provide because they've been screened in that sort of way. While some agencies are more or less, they're bringing on somebody on board and then they're going to just do it for placement, and there's really not that evaluation being done. And it kind of trickles into when you look at corrective measures, or when you look at some of the other pieces that I know we'll get into with just how do you address some of those issues that do pop up. And if you start with a strong foundation to build with, I think everything else that comes after that is you feel more comfortable when you're dealing with the various agencies. But I've had up to 6-7 contracts with agencies before, and some of them will start off great and then they fizzle out. But at any given moment, I could have probably 3 to 4 agencies with different staff members within the building through a 24-hour period.
Yeah, I mean, I would imagine even your favorite agency is not necessarily always going to have the people for the positions that you need filled. So it's a challenge. All right, Lynn, let's look at it from the operator's side and give some advice to them in terms of what should they be looking for to vet quality when evaluating staffing partners.
So I guess, what does a partner mean to you? So I think, Greg, you make such nice points about what partnership is. So for nurses to go into these buildings where they know no one, for you to provide them with mentorship, guidance, kudos to you. That's really awesome. I wanted to acknowledge that. So I think, when we think about a partnership and what clients need, I would look for what are the resources? Who's going to answer the phone for me after hours, right? 24/7. Who's my contact? What kind of support do I have? Do I have credentialing support? Is there someone keeping all of that information up to date, looking into people's credentials and making sure that they're up to date, getting renewed on time? And then can they provide me the support I need if there's an audit, right? If the DPH decides to come knocking on your door, could you quickly get that information from your partner as to whatever the DPH needs? Sorry. I think you'd also want to make sure that you had a way to submit concerns and get some answers to your questions. I think there's always going to be that need for some back and forth, some commitment to quality, like you said. And if there's a breach in that quality, that your partner wants to hear about that and wants to help you through that. So that's what I kind of think about when I think about partnership and what to look for.
And you're having these conversations before you sign a contract, not after. I mean, obviously it could be ongoing, but you want to know who you're working with before they send you people, right?
Correct.
You do.
Yeah. Even with Lynn mentioning kind of that partnership, it goes beyond just within the building and that particular CNA, the staff member. It goes on with what the agency's goals are and what if they align with what we're trying to do. And I think that can make a difference from agency to agency because you can build a certain level of trust that obviously you try to figure out what they can provide up front with the contract, but as those unique situations come up from day to day or week to week, it's kind of trial and error sometimes, and that's what makes improvements in quality of care. And knowing you have that right partner and looking to be on the same page about optimizing quality of care is huge.
And I think we're going to get into this a little bit later too, but I think we're talking about conversations, but are there other things that you maybe want to see in terms of platform or technology or even certain standards that they can prove they've met? Lynn, I'll give you that one maybe.
Sure. I mean, we have a robust credentialing department, and I would really highly suggest that that's a question. If somebody's coming into your building, I would think that you would want to know that they were fully credentialed, that you have the backup and can provide all of that as needed. What do they have for resources for their team members, for their nurses, for their CNAs, continuing education, supports around gaps in knowledge? Who's going to provide all that for team members? Who's going to help you through those processes, right? And what can we partner with to problem solve? There's so many situations that occur in a day, and Greg, I'm sure you can speak to them, that, when we put our minds together, we can do a really good job of figuring out root cause and how to prevent it in the future.
So let me ask you, Lynn, because you had a pretty robust quality assurance department. Is that unique with agencies? Again, how do providers that might be in a nursing home or a senior living community identify how good a QA program is? And what are the things that you really, are most proud of in what you do?
Yeah, we've really, I think, done a great job here of building out a QA team that is pretty inclusive of many levels of nursing, many different experts. We have nurses on our QA team from the long-term space. We have nurses who were DONs, who have worked in acute care, who have worked as CMS auditors, the breadth of knowledge on this team is very varied and it's wide. And, just having those types of supports for both our clients and our employees has proved really significant in this space. it's unclear to me how deep other agencies may go in this space, but we truly have a commitment to investigating with our client partners any concerns of the clinical nature. So if you were to report a concern to us, you will get a call back, and you should expect that call back to the reporter, to the DON, so that we can find out more about it and see how together we can work through the problem. And then on the other end, we are giving our employees a call. And we're working with them to, identify gaps in their knowledge, to provide retraining, upskilling, whatever the need is. We've even gone as far as to develop performance improvement plans so that our employees do feel supported and that we want to provide clients with the highest quality healthcare providers we can. There is a true commitment to that.
And I understand that.
Sorry.
Go ahead.
Speaking from the other side, just listening to that and obviously experiencing it, there is a difference in just that callback and just that conversation that takes place with the direct nurse to understand what's going on and also what the outcome was and what sort of specific details to that incident or that situation to how we want to improve it and trying to make sure that they are making their most educated decision in how they proceed and how they educate. That's a huge difference from agency to agency, and I think that's one that having worked with Lynn and her team, you can see a difference in what they present. And like I said, that callback is something that may be hard to do sometimes, but I think that goes a long way in us feeling comfortable with our partners.
And through that partnership, we've actually, sorry.
Oh, you go ahead.
I was just going to say, through that partnership, we've actually been able to find root causes to things that are both beneficial to clients and the nurses, right? So maybe we're having so many of these issues at this facility because there's a break in the system. And through those conversations, we often stumble on these breaks and are able to rectify things. And it's a win for everybody, really.
Kind of what I was going to say, Lynn, because I imagine being in Greg's shoes, as hard as it is to find someone, if I have somebody placed by agency who is just not quite there, has great ability, could get there, I don't want them to be so unhappy with how it's handled that they then, decline to come back to my building. So this win-win, I think, is a nice way of putting it, that you're trying to support that nurse, but also give the client what they need. All right, let's follow up on, I think I talked about standards. And Lynn, I understand that you guys went through Joint Commission accreditation process. Tell me a little bit about what that represents and why you wanted to pursue that.
Sure. So the Joint Commission represents quality, right? It sets its standards high, and it develops most of the policies and procedures that we follow are based in Joint Commission standards, right? They use experts, including CMS, to kind of create these standards, and it helps us to form the way that we want to provide standards and policies and procedures within our own company. So Joint Commission also demonstrates kind of continuous improvement. And so it's that continuous quality improvement, and it's the relooking, and it's the checking back, and it's all of those things that are never ending in healthcare that Joint Commission speaks so highly. People know Joint Commission, right? And if you're in the medical field, the healthcare environment, and you want to go for these accreditations, it's opening yourself up to audits, right? We get audited every 2 years, and then there could be interim audits in between, where it's a really deep dive into our processes, our protocols, how we do business. And, we also get a lot of information sharing through being in the Joint Commission. We partner with them. they have partnered with a plethora of other agencies, and they can sometimes bring best practices back to us or share our best practices with others. So it's that community of learning that also is really beneficial. And it really is just a commitment to quality.
I think that's a really nice thing to be able to offer providers. One of the criticisms I've heard quite a bit is that when something does go wrong, that the providers sometimes feel like they're left on their own. And I think to know that you have a partner who is willing to be held to account, whether that's in a bad situation or whether that's voluntary to prevent those bad situations, I think it probably is a symbol of integrity and maybe wanting to do the right thing as an organization. Greg, was that a factor for you? I'm not sure in the process of aligning with, I know you work with several agencies, but when you chose IntelliCare as a potential partner, do you remember if they already had Joint Commission, and was that something that you considered?
At the time when I've kind of started back a while ago with IntelliCare, so at that time it wasn't there. But obviously, since then, you can see how IntelliCare has definitely developed quite a bit with that quality and with that standard of care. And as time has gone on, they've looked for different areas to improve. And I think being a partner with IntelliCare in a couple different settings now, it was one of those pieces that really drove me to have IntelliCare come to Stone and be here and make sure that we developed it further, because when it comes to the quality care that we're providing and what we have for our clientele, that is exactly what we need. We need to have somebody on the other end that agency's not going anywhere anytime soon. As much as the goal can be for providers to say they don't want any sort of agency, in my eyes, it's a little more realistic to understand that we're going to have it, and it's a matter of making the most of it, the best of it, and making sure those partnerships really develop. So having IntelliCare versus some of the other agencies I've used, we talk about, in those bad situations of being able to pick up that phone and call and have that communication, that education. But there have been a number of cases where I've reached out, or my team has reached out and said the goods that we have from a particular nurse or CNA that's come on board and joined us through the agency, and what they've been providing and what sort of standard of care they have compared to some of our own staff, and how it excels in that. So I think that is a huge piece in determining any sort of partnership you use in any sort of aspect, and contract or vendors that you're going for. But the track record's definitely there with IntelliCare, but from my experiences from the early days of IntelliCare and how they've really developed.
I think,
So
you bring up a good point. Oh, sorry. I was just going to say, Greg brings up a good point of agency not going anywhere. I think one thing the pandemic showed us as well was, nurses need flexibility. They became teachers and caregivers and still had to hold down a job while holding down the family. And, there is a great need for flexibility within our workforce. And they actually became to really enjoy that flexibility during the pandemic. You could only work when you could work, because there had to be somebody, with the family, with the children. And I think it's a powerful thing to take control of your own kind of role, your own work ability. And we want to make sure that the quality of nurses holds up to what is needed in our facilities. And if per diem work and flex work is something that is going to stick with us, then let's make it a really great team.
All right, so I was going to go back to Greg and ask a little bit. I think we've covered this fairly well, so I'm going to ask Greg to do something I didn't prepare him for. But we talked about, if you do have some type of incident or something that needs more work or some kind of constructive criticism, you've talked about being able to pick up the phone and getting a response. I was wondering if you might have any examples or a story that you could share specifically, because I want to always put our audience, to see things through your eyes.
I think that one of the biggest examples I can give, and I'm sure the audience has been in this position before, is when you have an investigation of some sort of allegation, whether it's abuse or it's supposed from a fall, and when you're diving into the investigation to really understand from a facility level with the nurse or the CNA that could be involved is one of the agency staff members, and sometimes you don't know the next time that the person would be there because they may just come in once every so often. But being able to pick up that phone and communicate to the agency and say, we need to connect with this particular individual, and we even have the ability through portal with IntelliCare to be able to connect with that individual directly, and being able to inform IntelliCare and kind of keep the updates going of what's going on there. That is valuable, and not just getting the information for our investigation, but if it really pertained to something that happened with that particular individual, we want to make sure that we're doing our due diligence to help educate that individual, as well as if they're going to another facility, we want to make sure that they're not repeating the same issue at the other facility. And when it comes, a lot of times, I think that's more relatable when it comes to medication errors and any sort of medication issues there, whether it's transcription. So those are some of those day-to-day specifics that you can really see. You really can see a difference. I think a lot can be relatable to the audience with that.
And can you talk a little bit about being proactive around some of those things? Are there opportunities, things maybe happening through the agency that you're getting the nurse or the aide from, where they maybe are continuously learning or being monitored for learning opportunities, something like that, that should be happening to ensure that
Yep.
their quality is where you want it?
Yep, there's definitely, and sometimes there's specific skill sets that we would look for. And from time to time, I'll have to reach out and understand, and make sure that we have a particular nurse or CNA that is familiar with a certain skill set and be able to jump in for us and maybe help even educate our own staff in that situation. So that's some of the areas, and that's a little bit where that proactive piece comes into play, and that's more, and that goes back to the quality of care we're providing. And so when we see and we're screening or referral, and we feel we can handle a particular resident's complexity, um, we need to look at the next maybe 24, 48, 72 hours, and how, as they settle in, and who's going to be on board, who's going to take care of them, and if we have that void and we have an agency staff member that needs to be in that in one of those shifts there, we want to make sure that they're going to be able to handle it, and it's not going to negatively impact us as a facility, as well as put that nurse in a situation where they feel like they're not set up to succeed.
Right. All right, Lynn, let's go back to you. Again, in the case of either an incident or, a placement where maybe the staff member that you've placed is certified or licensed, it's not a question of whether they have the knowledge, but maybe they're not meeting the expectations in the building, and it's more of I'm going to say chronic issue. How do you work with that nurse to address maybe any shortfalls and to get them some additional resources so they can be better prepared to go back into the facility?
Sure. We have a tremendous amount of modules and education for nurses and CNAs within our platform, so they can self-identify their own knowledge, go ahead and take courses, free CEUs with us, whatever they need. Or if it's something that's brought to our attention, like you said, we're seeing a trend here where we're seeing, there's a gap in the CNAs or the nurses coming through. We need more trach care. We need documentation knowledge. Then we can proactively assign these things to our nursing professionals. If you want to work at this particular facility, here's what they need. That can also be, and Greg can speak to this, he can put things within his own hub platform, the client platform, that will show nurses coming in, this is a job on the trach unit. So if you don't have trach experience, please don't pick up this shift, right? So we can work that way to make sure we're getting the right people to the right positions. We've had situations where clients have told us, for one reason or another, they've got a tremendous amount of wounds, on the floor. And so can we make sure that the nurses coming in are have some expertise in wound care? So we can do those kind of things proactively to avoid errors, to avoid gaps. And then after the fact, we can also reach out to our nurses, our CNAs, talk about the shift, talk about how it could have gone better, point them in the direction of some education that might help them build confidence or upskill them. There's lots of opportunities for collaboration and support through education, through conversations, through being proactive and hearing what clients need from our IntelliPros, or our nurses and our CNAs.
And that proactive piece kind of goes into really the QA, the quality assurance process, and the performance improvement process, because everything we do for quality of care is involving some level of improvement. At some point, there's going to be a need for improvement. So with that ongoing proactive discussion, or that in mind, and kind of your day-to-day approaches and your activities, having that mindset of understanding that how can I make this better or safer, or just an overall better experience, that proactive discussion really has helped and gone a long way, just for our staff within the building, but being able to stretch that and expand to that agency staff, being able to help share that with other facilities and indirectly, just helps improve the quality of care as a community and as kind of on a larger scale of the industry.
And our account managers, I think, are great partners as well to both the client and to our QA team. So our account managers might be hearing things from clients and come back to the QA team and inform us of gaps that they're seeing, or hearing about, so we can build new education and we can get that out there for folks. So it is partnerships all around, even within our own work environment.
I wanted to ask, among all the specifics that you listed in terms of course offerings, there were a lot of clinical options there. One of the big criticisms I hear, though, is the relationship side. Do you offer any kind of soft skill training in terms of becoming part of a team and being viewed as an outsider, and maybe how to navigate that?
Yeah, that's an excellent question. So we do. We are working on these things, right? We are developing webinars for our employees. We do address kind of professional behaviors and, having that ability to come in to a new place and how to get along, right? How to use those soft skills to develop relationships within facilities. So those are all really important things aside from the skills. So we do address a lot of those things, as well as identifying exacerbation of different disease processes and how to, communicate with dementia patients and how to de-escalate situations. We do a lot of that as well, because all of these things are just part of the day, right? It's more than passing meds, and there is definitely a need for all of that relationship building with both clients, residents, each other.
Probably helps to retain too, because you're ideally making them more comfortable, but also more confident in their skills across the board.
Yes, I think that's really key to retention. It's a really hard job. I don't think I could do it. I don't think I could go from facility to facility and feel comfortable and supported. Yeah, I think it's a really hard job. These professionals are unique in the fact that they can go in with confidence and pick up a shift. And we're working on that too, right? We're working on how to go into your first shift, how to, what are some key things you need to ask? What should you look for? What should you do to set yourself up for success walking into a brand new client facility? Like, do you know who to call? Do you know where the charge nurse is? Where's the med room? Where do you get your supplies? Like all those kind of run through things before folks pick up a shift is really helpful as well.
All right, let me ask you a little bit more of a technical question. So my understanding is your company uses W-2 versus a 1099. And so you are viewing and treating your nurses that you're placing as your employees. Can you talk a little bit about why that might matter to your skilled nursing senior living partners? And then also, does that use of W-2 attract different nurses? Does it play a role in that?
I think it does. I mean, as a W-2 employee, you have support. As a nurse, I think, or a CNA, or anyone working in the field, I think you want to know that somebody's got your back. Somebody's there for you if you have a question, if you have a concern, if something doesn't go quite right during your shift, right? You have someone to call, help walk you through it, get you where you need to be. For the clients, I would think knowing that it's a W-2 employee and that the agency has fully credentialed and vetted these folks, and we're assuming responsibility for their credentials. We're saying that we stand by our nurses and our CNAs, that we have checked their credentials. We are making sure they're up to date, and we'll back you up on that. Having the support to even have the conversations when things don't go right. With a 1099 employee, I would not be able to call them and offer them re-education or, retraining on a skill because they're independent contractors, right? I don't have that ability. I would not be able to have that back and forth that we do between clients and employee and agency staff to problem solve, to make it better. If a 1099 nurse or CNA is asked not to return to a facility, that's the end of it, right? There's no, hey, Greg, what happened? I see you had Kim yesterday and this went wrong. How can we make that better? What happened? Let me reach out to Kim. Let me see what we can do there. All of that goes away. So I think just the accountability, the commitment, and the support that we're able to offer by having W-2 employees is really paramount to having a quality skilled.
I mean, I'm glad you just said commitment because I think that was a word that was going through my head as I listening to what Lynn was saying. Is there's a level of commitment there. Oftentimes you hear how agency staff may not be committed to that facility because they're in there for that one shift and may not come back for another one. But knowing on the other end with that level of commitment's there from the team that's supporting that agency staff member shows the level of commitment that individual's going to have towards not just the agency, but as well as the facility they walk into with the care and that they're going to provide. And then that's a huge piece that I look for out of my own staff is where you're committed to the better outcomes. You're not, yes, everybody's here for a paycheck, but we're committed to those residents and the care that they provide and make sure that this is their home. This is where we're walking into their home in trying to help with whatever ADLs that they need or just make an overall experience. And we're only here for a few hours of the day, so we need to be able to make the most of it for the residents' sake. So commitment's a huge thing. I mean, even going back to my days on the floor, is I wanted to make sure I had. Um, I made make sure I made the best of every shift and every interaction I had with each resident that I took care of, so they knew that I was there for them and I could provide and just for their outcomes, whether it was subacute rehab and they were going to be going home in a couple of weeks, or whether they had moved in and they were going to be living there. So commitment's a big one.
And like you say,
So I want to
although it is a business, right? It's a business on all of our ends, but the patient is at the center of it. And that's where the commitment starts. And that's where, that's where it needs to be on everybody's end. So it's a good
So you
work.
mentioned something, Lynn, that makes me want to circle back because as an outsider, I'm
Mhm.
uncertain what the answer would be. Say Greg contacts you or one of your account managers and says, "Hey, we had someone in the building yesterday that's just not a good fit. I don't want to have that person back." How do you handle that situation?
So we handle that situation the same we would with any quality concern, any clinical concern. We would call Greg, hey, Greg, heard you had this person in your building, don't feel they're a good fit. Is there more you can share about that, right? Because we want to be able to go back to our employee and say, you're not a good fit because it wasn't, your shoe color, it was because didn't you weren't able to pass math successfully. You weren't able to, get along with others. Like, what is it? So that we can then work with the employee, see their receptiveness to change and education or whatever is needed, and either keep them on, or if it's something egregious that Greg didn't want to share with the account manager but would be willing to talk with the quality team about, then that's another avenue, right? Then we go down another rabbit hole of digging into that and seeing what happened and how we can help and how we can support our team member, our employee, whether they need to be on a performance improvement plan. There's many options here for getting involved where you wouldn't have that with a 1099 employee if the same concerns. And then, that's a missed opportunity on so many levels.
And just real quickly on the performance improvement plan, if you have
Mm-hmm.
had a nurse in that situation, is that really based on education? Are you looking for certain benchmarks when they go back into a facility? How do you run that plan?
Sure. So it just gives that nurse some more supports, right? So it connects them with a quality assurance nurse. Together, they work through what the gap was in the knowledge. They would get assigned some retraining. They would have to do that retraining and take a little quiz, sorry, in order for them to then go back out. After their next shift, we might check back in. How did everything go? Did you feel like you were successful in completing your med pass this time? Did you use the strategies we talked about? It would be a situation where if that nurse's name came across our desk again, she would, again, her quality assurance nurse would connect with her and say, we're seeing there's still this problem here. Let's try, what more can we do, right? So it's a way of just putting some more arms around people, because when you're a nurse and you're working in a facility and it's your home base and it's your permanent position, you have a lot of support. You have a lot of people around you to help you and guide you and precept you and mentor you. I think Greg's situation is unique, that he extends those opportunities to staff from agencies, but we try to do that internally for our staff who aren't getting that out in the field.
Okay, terrific.
Yeah,
Thank you for the added detail.
Sure.
Go
I
ahead,
was going
Greg.
to say, yeah, absolutely. Ours is is a little bit more unique, and it's something that it's taken some time to build. And obviously, still, as I look at it, we still have room to grow and improve on. But yeah, there's a lot of times where agency staff have walked in a number of different settings I've been at, and there's really nobody there for them to bounce off of. So that's, I'm fortunate to be able to say I'm in that position to be able to extend that hand out, because my experience on the floor and just seeing how, a fellow coworker or a new staff member coming in feels and being a little lost, it just being able to share that at a greater level is kind of one of my goals that I've always had, and that's why I want to be able to extend out whatever my experiences and knowledge have been, with the team that I have here, and how that can probably and hopefully improve, and trickle into other facilities.
All right, terrific. Let's leave it on that for the main conversation. We do have some Q&A here, so prepare yourselves. No, it's nothing too out there from what we've already discussed, but I think some opportunity to reinforce. We had some questions very early on in the presentation about credentials. I mean, I think this is just such a huge issue, and providers feel really vulnerable around this. But Jeff asks, whose responsibility is it to verify the credentials of agency staff, the agency or the facility?
I can speak to that one on my end, where it ultimately comes down to the facility, and I think that's taking that approach can ensure that you have the entirety of that credentialing that you need. When it comes to like IntelliCare, they're able to get some of that information squared away up front, and knowing that they're going to have that complete profile in the portal makes it a little more of an ease for, on the facility end, because we know that when there's somebody new coming on board, we can go ahead and make sure that everything's right there, click through all the documents we need to, and just know that process has already been done. But ultimately, we want to make sure we do that quick little check, because any of the other agencies that are coming in may not have that. And you maybe, there have been times where I've told that the packet's there and the agency's done what they need to do, but I've tried to ask and obtain a copy of it and to have on file, because if DPH is in, or anybody, if they're in and asking particular questions and that agency staff member is here, they could ask for that file right then and there. So the neat piece with IntelliCare is you can pull it up at any given moment. Otherwise, I've had binders full of agency staff members, that people that may have only shown up once, just in case.
Right.
Yeah.
Did you want to add to that, Lynn?
I mean, I think we all have a responsibility here. Definitely, we take the responsibility of credentialing quite seriously here. And our clients are able to expand their, some clients require dementia training because they have a memory care unit. That's a flip of a switch, and then that's a document, and that's training that we need to provide. So there is, again, going back to that partnership, but we definitely do assume responsibility for doing a good job credentialing for our partners.
And are you also able to monitor, Lynn, requirements for CEUs or renewals and things like that?
So we don't monitor CEU. For nurses' licenses, we don't. That's up to the nurse, right, when they're renewing. But we do monitor their license, right? Is that up for renewal? Is it current? Same with, trainings and other required things, CPR, those kinds of things.
And do you prompt the nurse and say, hey, your deadline's coming up, just to make sure that they are working toward filling whatever obligations they have and staying in play?
Sure, for some things, not for everything, but for some things. And when something is, expired, a training or whatever, they will get locked out of shifts and be reminded at that point, like this has slipped, like take some time.
Have a fail safe. I think that's reassuring that there is, because again, Greg can have the information in the app, but if he's super busy, as he probably is every week, and he can't check, oh, this person's coming to my building next week, I better recheck. They haven't been here for a couple months. that helps him to have some confidence in that.
And I've seen it
Let
on
me
the other
ask.
end too when it comes to when it comes to the profile, and if there's something that needs to be renewed, and all of a sudden we get an alert on our end that they're missing documentation too. So it's been in situations that has prompted us to go ahead and communicate out to that nurse or CNA, because they've been here frequently, just to say, hey, you need to go double check this real quick, otherwise you're not able to be on the shifts that you already selected.
All right, I want to get to two more questions, so I'll keep this one brief. But how do you combat issues with agency staff properly documenting?
That is a big one. On our end here, we make sure that we can kind of go to that mentor program to pair them up, and making sure that their logins are working right up front when they come in, and if they need any assistance. So we have different team nursing leadership that can go around, and they'll just check in on the staff to make sure that they're familiar with the documentation. And we have a practice where we've been able to run a compliance report to make sure that all our documentation is completed before the shift's over, and where the gaps may lie. And if I've had those issues where somebody's consistently not documenting, then that's something that I bring to for example, to Lynn's attention, to be able to have them reinforce that the documentation is required.
Mm-hmm. We hear about documentation. Ultimately, for a CNA, they report up through a nurse, and that should be something that's communicated at the end of the shift. Did you document? But it is also a job. It is a responsibility, and it is your job to get that done. Documentation, we hear on our end that such a high percentage of the time it's because of those login credentials, whether they can't get them, and whether sometimes it's that quick last minute shift that's picked up, and the credentials aren't attained in a certain amount of time, and that's where working together again, getting to the root cause has been really instrumental in being successful.
I guess you need a workaround in that situation, that somebody writes their notes and someone else puts it into the system or something along those lines. All right, I have time for one quick last question. I want to give this one to Greg. Had a couple of comments really seeming to embrace your idea of building up the staff, whether that's your permanent staff, whether that's your agency, and treating them as one. Do you have like one or two takeaway tips on how to promote that kind of supportive environment with this blended staffing?
Biggest thing is trying to sometimes change that culture of the staff that are in the building, and trying to use sometimes maybe agency as a scapegoat. If something didn't go right, oh well, as the agency staff member was here for that. Trying to get away from that and understand that we're all a team. It doesn't matter who made the issue; the issue is still there. But when it comes to the more morale piece of it, sometimes it's gone. I've seen it go further with when we having pizza for lunch, or we're catering a lunch, or during the holidays when it comes down to having those holiday luncheons and different events going on, in making them a part of it, making sure that they're coming out, having, enjoying, whether it's the meal or the activity we're doing, and just really extending that arm out and just in a handout, just saying, no, you guys are involved. You guys are included. It's not just because you're here today and you're going to, you can't have any of the, fun festivities. That I think has gone a lot further than sometimes just the direct work, because it's, yes, we're all here to do a job. Yes, we're here to work and care for the residents, but being able to know that you can go in and, who knows, I might surprise them with a lunch or a dinner or whatever the case may be, a breakfast too. I've gone out and been a part of it. Anytime we do hold a monthly breakfast, I'm the one flipping omelets or doing crepes or whatever the case may be. I'm right there with them too. So I think has gone further, so they're familiar with who's there from the top down, and then just expanding that, encouraging our staff to do the same. So it kind of goes a little bit into setting the example that way, but really having them involved and do that without me knowing. I don't need to know every single moment that they do it. I just need to know that they're doing that to make them feel comfortable.
All right, thanks, Greg. I'm going to have to cut you off there because we are almost out of time. So obviously, we'd love to give our thanks to Lynn and to Greg for walking us through this great quality assurance conversation today. A reminder that our session was sponsored by IntelliCare, and you can learn more about them at intellicare.com. And also, this is part of a 5-session event coming up next at 1 p.m. Eastern. McKnight's is bringing you another 4-credit session. Stick around for a case study on creating your own float pool using partnerships. And finally, this session and all of those from today's Workforce Development Forum will be archived and available on demand shortly after this live broadcast. You can see the URL there on your screen. And for McKnight's, this is Kim Marcellus. Thank you so much for tuning in. Have a great afternoon.